Okay, now, the different techniques we have. Ito class, these are the different types of these are the different types of histotechniques. Nasali lang dito yung identification and labeling, pero the histotechnique starts with fixation talaga. Okay? We will go more deeply on the histotechnique class when we pag nakakating na tayo sa finals. Why? Because histotechniques is the component of our laboratory for histopath. Okay? That's why pag finals na, discussion for histotechniques, and then pag na-lift na ang GCQ, we're going to perform it on the laboratory. Okay? So fixation, dehydration, clearing, impregnation, embedding, sectioning, staining, and mounting. Okay. Next topic is histoprep. Okay. Histologic preparation. Have you discussed this in histology? No?
Yes, sir.
We have discussed histologic. So we're going to run through with the different histoprep. Okay? What is histoprep? Okay, the different types, the methods, advantages and disadvantages of the examination of fresh tissues. Okay, so why do we need, or what's the importance of doing a fresh tissue examination? So, fresh tissue class, we are examining it on a living state, thereby allowing protoplasmic activities such as motion, mitosis, phagocytosis to be observed. Okay, stool exam, di ba? In parasitology, using NSS, that is fresh tissue examination. Okay? While for the disadvantage, the fact that the tissues examined in a fresh state are not permanent, therefore are liable to develop the changes that have usually been observed after death. So fresh tissue, kukuha ka ng sample from the living state, put it on a slide, NSS, but you can only observe it on a limited time. Why? This will be viable lang siya for a limited period of time. After that, i-discard na kasi hindi na pwede. Okay? So, first method for tissue examination is teasing or dissociation. The process whereby selected tissue specimen is immersed in a watch glass containing isotonic salt solution. Okay, NSS, tissue, and then we're going to observe it in the microscope. Ito yung pinaka-easy, ito yung pinakamadaling method of fresh tissue examination. The tissue, NSS, and microscope. So what do you think NSS siya? Okay, NSS is isotonic. Okay. Next is squash preparation or crushing. From the term itself, class, a slide, specimen, and then cover it with cover slip or another slide. In that way, naka-crush yung tissue and then luminipis to be able to be viewed in the microscope. The disadvantage lang of squash preparation class is some cells are being destroyed. Okay? ito yung, the other term for this is pull apart. Okay, class? This method is usually done or is usually used in if the specimen is tissue fluids, okay, or body fluids. And then, ito yung next method is smear preparation. So we have different techniques in doing smear preparation. The process of examining sections or sediments whereby cellular materials are spread lightly over a slide by means of a wire loop, an applicator, or an opposite smear. Okay, first is streaking. Diba sa microbiome sa bacteriology, you perform streaking of a specimen on an agar plate for inoculation. Tama? Spreading, okay, performed usually in hematology. A blood is being put on a slide, use a spreader to spread the sample. Okay? Another form of streaking class or spreading is the one you are being performed, the one you performed on AFD slides. Yung coiling, slide, wire loop, specimen, and then you perform circular motion on a desired measurement of a sample on a slide. Okay? That is also, ano pa rin siya? Spreading pa rin niya. Okay? Question so far. Okay? So this is streaking, zigzag motion on a slide. Okay? Spreading, ito. Ito yung AFB. Diba? Wire loop, specimen, and then you perform circular motion from inside to outside. Okay? Nag-perform ba kayo ng AFB? Or gumawa ba kayo ng slides for AFB staining? Yes. Familiar ba kayo sa ganitong smear preparation? Anyone?
Yes, sir.
Yes, sir.
Familiar kayo? Okay. So baka tayo nag-show ako ng ano pa rin niyo na naintindihan ha. Okay. Next method is touch preparation. It is also known as impression smear. Okay? The dabbing of the clinical specimen. It's either classed as a slide, a tissue sample, or a cut, or ulcer, or a wound. Okay? Diretso siya sa slide. Okay. Okay. Onto the microscope slides to distribute a thin layer of cells for microscopic examination. Okay. Preparation of direct impression from the cut surface of the tissue like the lymph nodes and other surgical or autopsy secretions. Next is frozen section. Ito yung pinaka madalang or pinaka less na nangyayari sa isang histopath lab. Why? Scheduled ito. Frozen section procedure is a pathological laboratory procedure to perform rapid microscopic analysis of a specimen. Rapid, mabilis. This is used most often in the oncological surgery. Okay, the technical name for this procedure is cryosection. Okay. Sino dito ang nung senior high school kayo, nakapag-duty sa laboratory na merong histopath? Wala? May idea ba kayo kung paano pinaperform ang frozen section? Okay. Frozen section class is done by a pathologist. Okay? Hindi pwede ng medtech, hindi pwede ng nurses. Okay? Doctor, specifically pathologist. Okay? So, the surgeon class, they will going to operate the patient sa OR. Tama? Okay. For example, breast mass. Okay? Breast mass. Tumor na nasa breast. Yung surgeon class, kukuha siya ng sample Operahan niya ang patient, kukuha siya ng sample, and then the nurse class will automatically deliver the specimen sa laboratory. Class, open pa ang patient hindi pa siya tinahi. Okay? Kukuha ng sample, dadalhin sa lab, the pathologist will going to perform frozen section directly sa specimen. Mabilisan yun. And then, after frozen section has been done, okay, tatawag na ang pathologist sa OR. Okay, ano yung result? Merong dalawa. It's either benign or malignant. Pag benign class, i-close na ang patient. Tama? Kasi benign, hindi cancer. Pag malignant class, what will happen? The result will either be the removal of a breast or both. Okay. Kaya open pa yung patient. Kasi hindi pa natin alam kung ano ang future or result ng biopsy. Okay. Kaya kailangan open pa siya kasi hindi natin alam kung benign or malignant. Kung benign, close na siya kasi benign lang naman. Pag cancer or malignant yung tumor, okay, iniiwasan na mag-spread or mag-metastasize. So it's either removal of the breast part or both of both breasts. So that's the method for frozen section. Okay, merong manual performed by the pathologist using carbon dioxide and then sliding microtome. Later on, we'll go into discuss the different types of microtome. Or, katulad yung nasa picture class, the pathologist is using cryostat. Okay? Next topic will be instrumentation. Pero hindi ko na alam paano. Sorry, hindi ko na. Welcome sa mga bagong pasok. Sorry, hindi ko nakita yung chat. We are 32 already. Okay, instrumentation. Class. Instrumentation. Okay, basic lang tayo for instrumentation because we're going to discuss more of this when we go to sectioning. So, every medical technology professional subject starts with microscope, di ba? Ito nga yung symbol or yung seal natin sa medical technology. Medical technologist, okay? So have you done your assignment so far? So these are the basic parts of a compound microscope. But for histopath class, we are more inclined in using the microtome. Okay, so we have 6 types of microtomes. We have rotary, base ledge, rocking, sliding, freezing, and the ultra thin microtome. Ito yung mga basic. Okay, so we're going to discuss more of this detailed on sectioning, part of the histotechnics. So rotary microtome, also known as Minot microtome, because it's invented by Minot on 1885 to 86. See, it cuts paraffin-embedded tissues, and it's the most common type of microtome. So, rotary class yung meron tayo sa lab. Rotary microtome. Next is sliding microtome developed by Adams in 1789. This is usually done used for celluloid embedded tissues. Base ledge microtome has 2 movable pillars holding the adjustable knife clamps, also for celluloid. Rocking microtome, it is the first microtome class invented by Caldwell in 1881. So this is the simplest type of microtome. The freezing, ito yung ginagamit sa lab. Hindi na change ang slides.
Hindi, sir.
Yes, sir.
Hindi siya instrumentation sa inyo. Okay, wait lang. Lang. Sorry. Yan. Okay na ba? Okay na ba ang slides?
Okay na po, sir.
Okay.
Sir.
So, run through ulit tayo. Okay, ito rotary. Ito yung meron tayo sa lab class, rotary microtome. Sliding. So for celluloid. Base ledge also for celluloid. Base ledge class is para din siyang sliding. The only difference is meron siyang dalawang pillars holding the knife. Okay? Rocking, the very first microtome, the simplest microtome. And then the freezing microtome. Okay? Ito yung ginagamit manually for frozen section. Kung magkakaroon kayo ng chance to do internships sa doctors or sa ibang hospital na meron histopath, meron sila nito. Okay? Pag hindi naman ito, meron tayo yung cryostat for frozen. Okay, ultra thin microtome. This is a special type of microtome class used for electron microscopy. So cutting section at 0.5 micra. So for electron microscopy, the knife used consists mainly of selected fragments of broken plate glass. So ito yung medyo social na type ng microtome. Kung nakikita ninyo class, the microtome, merong naka-embed na microscope. Diba? To ensure na 0.5 micra lang talaga yung thickness ng tissue. Okay, and lastly for microtomes, we have the cryostat. Okay, cryostat class is a refrigerated apparatus used in fresh tissue microtomy. Okay, so what type of microtome ang nasa loob ng cryostat? We have rotary microtome.
Rotary.
Okay, the only difference class is refrigerated siya, meaning controlled temperature ang cryostat. Okay. hindi ka na kailangan kasi class yung freezing microtome, kailangan mo pang gumamit ng carbon monoxide to freeze the tissue before performing frozen section. Ito class, diretso na siyang mag-freeze. Okay? And then the pathologist will going to section the tissues. Okay. And last instrument for this topic, we have the automatic tissue processor, also known as the Auto-Technicon. Okay? If you have done your assignment, okay, sa first week, we have this on video, di ba? So ano ba ang trabaho ng Auto-Technicon or the automatic tissue processor? It's available since 1941. This is characterized by the transfer of tissues contained within a basket through a series of stationary reagent arranged in line or in a circular carousel plan. Okay, those different types of containers class contain different types of reagents. See? So from fixation until embedding, yung reagent na nakalagay dyan. So, ano ang piniperform nito? Basically, class, Auto-Technicon perform histotechnique. Okay? So, paano? Paano ba siya gumagalaw? So, circular motion ka clockwise. Pero dapat yung reagent niya class, tama din ang pagka-position. Okay? So, naka-time siya to transfer a specimen from one container to another. So, ano ang ano yung napapadali sa trabaho ng medtech? Okay? Ito yung pag-transfer ng specimen from one container to another. If you have watched the video class, makikita ninyo doon na manually piniperform or tinatransfer ng medtech yung specimen from one container to another. But with Histotechnicon or Auto-Technicon, hindi na kailangan yon. Okay? Diretso na siya. So, computerized, the transfer, ano na lang gagawin ng medtech? Maglalagay ng specimen. Okay? So the next topic class is inflammation. Wait lang, hindi ko siya makita. Here. Na-change ba ang slides, class?
Yes, sir. Yes, sir.
Inflammation na ba tayo? Okay. Wait lang kasi naghang. Do you have any questions so far? Basic pa lang tayo, class. Nandun pa tayo sa introduction with histopath. Ayun. Okay, welcome sa mga bagong pasok. Okay. Nakikita ba ninyo, class? Inflammation.
Yes, sir.
Okay, inflammation is defined as the local response of living mammalian tissues to injury due to any agents. Okay? So the types of causes of inflammations, we have infective agents like bacteria, viruses, toxins, and fungi, also parasites. For immunological agents like cell-mediated and antigen antibody reactions. For physical agents, heat, cold, radiation, mechanical trauma. For chemical, we have organic and inorganic poisons. And for inert materials, we have foreign bodies. Okay. So what is inflammation? It is a response, okay, to any agents of inflammation. It can either be acute or chronic, but the local reactions are described as the cardinal signs and symptoms of inflammation. So we have five. Actually, because we have four. The loss of function was added recently by Rudolf Virchow. Okay, so four lang siya originally. So we have rubor, tumor, calor, and dolor. Redness, swelling, heat, and pain. The fifth is functionalisa, added by Virchow. Okay, so what are these different types of inflammation? So first we have acute. Okay, so depending upon the defense capacity of the host and the duration of the response of inflammation, and then it can be classified as acute or chronic. So what are these two classification class? So acute class, kung nakita niyo sa presentation, stimulus, helper cell, and then healing. Chronic is while there is inflammation, the stimulus is still ongoing. Okay? Merong repetition of cycle. Stimulus, helper cell, walang healing because it will go to stimulus again. That's why chronic inflammation is described as prolonged inflammation. Okay? For acute class, we have 3 stages for acute inflammation. Vasodilation, increased permeability, and the movement of the WBCs. Okay? So ito yun. Vasodilation leads to increased blood flow, causing redness and warmth. So rubor and calor. So increased permeability leads to exudation of protein-rich fluid into the extravascular space. So merong swelling, so tumor. And then the loss of fluid from the vessel leads to concentration of redness. Okay, red cells resulting in decreased velocity and stasis of the blood. Okay? So, for example, class, mosquito bite. Okay? So, merong stimulus, merong infection. Kinagat ka ng lamok, what happened? Merong toxins, class. Okay? The mosquito injected the toxin sa balat. Okay? So, the body's reaction will going to constrict the blood vessels on the portion na may kagat. So, magkakaroon ng constriction first, and then vasodilation for the blood flow to increase. Okay. Why do we need to increase the blood flow, class? Anyone? Vasodilation, okay. To increase the blood flow for WBCs, okay, and then proteins. So after the class, increase permeability. Okay? Para lumabas yung mga protein-rich fluid from extravascular going to the portion of infection. Okay? After that, the loss of fluid leads to concentration of RBCs. So, merong stasis, and then meron ng leukocyte rolling, adhesion, and migration. So, after this class, after that, meron ng healing and repair. Okay? That is acute inflammation. Okay? The fate of acute inflammation, it comes to resolution, complete return to normal tissue, healing. Okay? Merong fibrosis takes place when the tissue destruction in acute inflammation is extensive so that there is no tissue regeneration. Okay, resolution class, merong tissue regeneration. The tissue returns to its normal appearance. Healing naman class, impossible yung tissue regeneration, so i-replace yung damaged tissues with protein. Yung magkakaroon ng fibrosis. Okay? Ulcer, the loss of mucosa and deeper tissues. No replacement, the tissue will not become normal again. So, ulcerated siya. Merong depression. Okay? In other, like yung mga hollow tissues like blood vessels, if grave yung injury, magkakaroon ng fistula. It's anomalous patent connection between two organs, most commonly organs with a lumen. Okay. Fistula class is para siyang a space between two hollow organs, like your blood vessels, your intestines. Okay. If you have encountered fistula sa mga patient na undergoing
Dialysis, sir.
Yes, dialysis. But the fistula for those patients class are surgically attached. Okay. So, para saan yung fistula ng mga patients who undergoes dialysis? Okay. The fistula class is doon na nila ina-attach or doon na tinutusok yung needle for dialysis. So, hindi na nila kailangan maghanap pa ng area for needle. Doon na ina-attach directly sa fistula. Kung napapansin nyo class sa mga patients na nagda-dialysis, meron silang parang malaking bulge doon sa kamay nila. So that is fistula. So kailangan ng surgery to attach that. I think the process class is parang pinuputol yung vein and then mag-attach sila ng parang yung fistula to attach both veins na naputol. Okay? And then doon sa portion na yung class, doon na tinutusok yung needle for the needle for dialysis. Okay. Next, suppuration. Ito yung medyo pathologic. Okay? Suppuration class is when the pyogenic bacteria causing acute inflammation result in a severe tissue necrosis. Okay. The process progresses to suppuration, subsequently mixture of neutrophils, bacteria, fragments of necrotic tissues, cell debris, and fibrin comprise pus, which is contained in a cavity to form an abscess. So yung medyo masakit na portion. Okay? Inflammation na merong pus. Okay? Suppuration. Okay? Scar formation, replacement of lost parenchyma with disorganized connective tissue. For example, collagen. Okay? Yung mga scar formation. And then, acute inflammation can also become chronic. Okay? So this is an example of suppurative inflammation. Okay, the first picture class is a picture of a brain with an inflamed meninges. Obviously, this is caused by a Streptococcus pneumoniae causing acute meningitis. Okay. The second picture is an abdominal cavity opened at autopsy here to reveal an extensive purulent peritonitis that resulted from rupture of the colon. Okay. So, natanggal ang brain. So, obviously, dead yan silang dalawa. Okay. For chronic inflammation, prolonged inflammation consisting of active inflammation and tissue destruction and repair all occurring simultaneously. Okay, di ba? Sa picture kanina, cycle yung process for chronic inflammation. May stimulus, mayroong involvement of different cells, pero walang healing. Babalik ulit sa stimulus. Okay. The cause of chronic inflammation, okay, following acute inflammation or recurrent attacks of acute inflammation, chronic inflammation starting de novo. Okay, yan yung example class. All in one. Okay? So we have two types of chronic inflammation. See, the non-specific and then the granulomatous inflammation. For non-specific, it's characterized by non-specific inflammatory self-infiltration. For example, chronic osteomyelitis, lung abscess, and actinomycosis. So have you discussed actinomycosis in mycoviro? So it's caused by actinomycetes. Okay? Familiar? Hindi pa kayo naabot doon. Mabot na ba kayo doon?
Wala pa po.
Okay, so actinomycosis, actinomycetes class, or ano ba sila? Actinomycetes are fungi but can also be classified as bacteria. If you have ever encountered actinomycetes in bacteriology, di pa ba? So meron silang characteristic of a bacteria, meron din silang characteristic of a fungi. Okay? So usually causes infection, okay, non-specific inflammation, chronic non-specific inflammation. So this one, class, osteomyelitis is the infection of the inner bone. Okay? Stated is a name given to an infection of the bone that can be caused by the bloodstream or through infected adjacent tissues. And then granulomatous inflammation. Merong formation of granuloma. Characterized by formation of granulomas, for example, tuberculosis, leprosy, syphilis, actinomycosis, or sarcoidosis. Okay, the picture, class, is in appearance of a person having leprosy. Okay. So what are the cells involved in chronic inflammation? So we have two basics, okay? The macrophages and the lymphocytes. So the macrophages, class, activated macrophages produce proteases, IL-1, tumor necrotic factors, arachidonic acid, metabolites, and no angiogenesis and growth factors such as platelet-derived growth factor or fibroblast growth factor. Okay, class. Macrophages, class, is located on different parts of the body. If you have discussed this in histology, we have different terms describing macrophages on the different parts of the body. So iba-iba yung pangalan nila depende kung saan sila located. Okay. For lymphocytes, activated lymphocytes produce FGF, stimulates fibroblasts to produce collagen, which results in scarring. Okay, lymphocytes. And then PDGF and transforming growth factors beta and interferon gamma. Okay, so these cells, class, work hand in hand for the resolution of chronic inflammation. But okay sana kung walang simultaneous na injection of stimulus. Yun lang, merong, di ba, cycle siya. Stimulus, cells, stimulus again. So kaya siya prolonged inflammation. So, inflammation, class, we will going to discuss this thoroughly, cellularly in immunology. Okay? So, granulomatous inflammation. Okay? Granulomatous, class, formation of granuloma defined as circumscribed tiny lesion about 1 millimeter in diameter, composed predominantly of collection of modified macrophages called epithelioid cells and rimmed at the periphery by lymphoid cells. Kung nakikita nyo, class, in this picture, this is a granuloma composed of modified macrophages, ito, epithelioid cells. Nakapalibot dito ang mga lymphoid cells. Okay. So, a group of this granuloma can cause, katulad dito, class. Diba? Parang tumor-like na siya. Okay. So, this is granulomatous inflammation. So, that's the end for inflammation. After inflammation, we have cell growth. Okay, wait lang. Okay ba? Okay, for cell growth, class, cell growth patterns. Okay? So the cells of the body, continue to grow, divide, and differentiate throughout life. So normally, growth and differentiation are controlled in such a way as to maintain the normal structure of the particular tissue. So, for example, the skin, the intestinal mucosa, and the blood, characterized by labile stem cells, which continuously undergo mitosis to replace lost cell. Okay, class. We have the if you've ever discussed this in histology class, okay, the basic formation of cell comes from blastula, okay? Blastomere, okay? Diba? The union of egg and sperm, and then it will going to be fertilized, and it will going to form a zygote, and later on become a blastula. So lahat ng cells from the body comes from the blastomere. Okay? So yung development. So what is the difference between cell growth and cell differentiation? So cell growth, it is a process of increase in size and mass of a cell resulting from a synthesis of specific cell components. So lalaki ang cell at bibigat. Okay? So, while cell differentiation class is a process whereby a cell develops an overt or observable specialized morphology or function, which distinguishes it from its parent cell. Okay. Balik tayo sa blastula. Iba yung blastula, meron siyang layers. Ectoderm, mesoderm, and the endoderm. So, those layers class, it will develop into another form of mature cells. Ito na yung composition ng body ng human. From the ectoderm, dyan galing ating skin, the brain, and the different glands. From the mesoderm naman, dyan galing ang muscles, bones, and the connective tissues. And for the endoderm, dyan galing ang epithelium, and epithelium class ay yung inner epithelium. And then, the different organs or the intestinal organs or systemic organs ng body. Internal organs natin, dyan galing sa endoderm. Okay? So, as differentiation of course class, meron ding disorders for cell growth. So we have 7: hypertrophy, hyperplasia, atrophy, metaplasia, dysplasia, anaplasia, and neoplasia. So first, hypertrophy. Hypertrophy class refers to an increase in size of the cell that results in an increase in size of the affected cell. So we have two types of hypertrophy. We have physiologic and pathologic. So physiologic class, the common example of physiologic hypertrophy is seen on those people who go or performing bodybuilding. Okay? Lumalaki ang muscles because lumalaki yung cell ng muscle. Okay? The hypertrophied organ has no new cells, but it becomes larger. Okay? So larger cells is equivalent to larger organ. So hypertrophied cells is equivalent to larger organs also. So for pathologic hypertrophy, ito yung example. Pathologic ventricular hypertrophy of the heart, usually caused by chronic hemodynamic overload resulting from either hypertension or faulty valves. Lumalaki ito, this is ventricles class, because of increased blood flow due to hypertension. Okay, this is the normal heart. This is the pathologic one. Hypertrophic left ventricle. Okay. Yan. Okay. Next is the mechanisms. So hypertrophy have 3 steps. Integration, mechanical sensor, okay, activation, and signal pathways. So this class is steps on the molecular pathogenesis. So ano-ano ito sa taas? Ano-ano ito sila? For integration class, we have mechanical sensor, and growth factors. The cells class, I will give you an example. Diba? The cells of the body, specifically yung mast cells, needed protein. It feeds on protein para lumaki. Right? Parang ganito lang yun yan. So, it needs different types of chemicals for it to absorb and then to increase its size. Okay. Ito yung mechanisms ng hypertrophy. So first, integration of the different types of sensors and chemicals. So we have growth factors, basically. Next is activation of the signal transduction pathway. And lastly, the signaling pathway activates a set of transcription factors. So usually the GATA4, NFAT, and NEF2, which work coordinately to increase the synthesis of the muscle proteins that are responsible for hypertrophy. Usually, the example for hypertrophy is usually muscles. Okay? Next is hyperplasia. So, hyperplasia and hypertrophy are almost similar. The only difference class is hypertrophy, increase in size, while hyperplasia is increase in number of cells. Okay. So hyperplasia is defined as an increase in the number of cells in an organ or tissue in response to a stimuli. It can only take place if the tissue contains cells that are capable of dividing. So like hypertrophy class, meron siyang dalawang category, physiologic and pathologic. For physiologic class, we have two, hormonal hyperplasia and compensatory hyperplasia. If you go through the pictures class, this is a mammary development postnatal. Okay. The example of hormonal sensitive organ, for example, proliferation of the glandular epithelium of the female breast at puberty and pregnancy. Kung nakikita niyo yung picture class, this is the appearance of the breast of a female postnatal after siyang manganak. Diba lalaki? To accommodate, diba lalaki siya to accommodate milk for lactation. After the cycle class, delete na naman siya kasi stop na yung lactation. And the hormone also stops producing. Okay? Milk. Okay? Another is compensatory hyperplasia. This is seen in the regeneration of liver after a partial hepatectomy. Okay, the remaining cells proliferate so that the organ soon grows back to the original size. Okay. Diba the liver class has different lobes? Kaya nga tayo, diba, pwede tayo mag-donate a part of our liver to another person. And then, our own liver will compensate for the lost part. Okay? It will going to proliferate hyperplasia para ma-accommodate yung nawalang lobe ng liver. So that is compensatory hyperplasia. So for physiologic, hyperplasia is production of RBCs from bone marrow in response to a deficiency like anemia. For pathologic hyperplasia class, caused by excessive or inappropriate actions of hormones or growth factors acting on cells. Okay. For example, endometrial hyperplasia due to increased amount of estrogen. Okay. Usually class, hormonal siya, pero walang stimulus. Sa ibang level class, hyperplasia can lead to cancer. Okay. Another example is in response to a viral infection, okay, like HPV or human papillomavirus. Nakikita niyo yung picture class, this is the appearance of a HPV infection causing warts. Okay? Yan. It can constitute a fertile soil in which cancerous proliferations can arise when growth factors mechanisms becomes deregulated or ineffective because of genetic aberrations. Okay? So pag hindi na-stop, it can lead to neoplasia or cancer. So hyperplasia. Next is atrophy. The opposite of hypertrophy. Okay. is defined as the reduction in size of an organ or tissue due to decrease in size, cell size, and number, resulting in the decreased functional ability of the cell. So again, it has two types, physiologic and pathologic. For physiologic atrophy class, it's common during normal development. They include, okay, atrophy of the thymus, ductus arteriosus in infants, uterus after parturition, okay, giving birth. Diba? The size of the uterus will accommodate the developing fetus. Maging baby siya. After nanganak, after parturition, the uterus, babalik siya sa normal size niya. So, atrophy of the uterus after parturition. Okay. Atrophy also class, physiologic, yung mga patients who are in coma. Diba? Pag comatose yung patient class, atrophy of unuse or misuse atang tawag doon, hindi nagagamit yung muscles. Okay? Also in patients class na nagkaroon ng polio. Okay? Polio. Diba nakikita niyo yung isang ano nila? Hindi siya because the infection occurs on the extremities. It is, the infection happens to be on the nerve. Okay? So, polio infection class, yung patient, after the infection, hindi na nila na-feel yung portion or the part of their extremities. So, hindi na nila magagamit yon. So, pag hindi nagamit, lumiliit yung portion ng body. So, it atrophied. Tulad nito. This is a picture of a patient na nagkaroon ng polio infection. Okay? Okay. So, atrophy, pathologic. Okay. The profound protein calorie malnutrition, also known as marasmus. So, atrophied yung body nila class because of malnutrition. So, seen in aging, this is associated with cell loss, typically seen in brain and the heart. Okay. Next is metaplasia. Like, metaplasia is an acquired form of altered differentiation. Is the reversible transformation and replacement of one type of terminally differentiated cell into another fully differentiated cell type. Okay. So metaplasia often represents an adaptive response of a tissue to environmental stress. Okay. The metaplastic tissue is better able to withstand the adverse environmental changes. Okay. If you look at the photo class, from columnar epithelium, it became squamous. Okay. The picture is a metaplasia of columnar to squamous epithelium of the bronchi, okay, of the lungs. This most common metaplasia is a columnar to squamous occurs in respiratory tract in response to chronic irritation as seen in an habitual cigarette smoker. Okay. So, nag-change yung cells niya, nag-adapt because of response to a stimulus. So, cigarette smoking, irritation. So, from columnar, naging flat, squamous. Another is, in cases of Barrett's esophagus, ito naman metaplasia from squamous to columnar because of the reflux of gastric acid. Okay. Another example is connective tissue metaplasia. Ito naman class physiologic. Connective tissue metaplasia, formation of cartilage to bones. From, di ba? Our bones from the start, ng baby tayo, from fetus Okay, cartilage yun lahat. As we go, as the fetus matures and hanggang naging baby siya, it became a bone. Okay? So it is a metaplastic formation from cartilage to a bone. Next is dysplasia. Okay, it is literally known as disordered growth. It's an abnormality where tissue partially loses the morphologic characteristic of a mature cell. Okay? We have four changes. Anisocytosis, okay, unequal size, poikilocytosis abnormal in shape, hyperchromaticism, excessive pigmentation, and presence of mitotic figures, unusual number of continually dividing cells. Ano yung common example niya? Okay, dysplasia, for example, it lose uniformity and architectural orientation of the cell. Bakit ito? Okay, dysplasia class is the earliest form of a precancerous lesions. So, it's safe to say class the dysplasia formation class will develop into a cancer. Okay? It's also an indication of a premature neoplastic progression. Okay? Dysplasia may also develop without coexisting metaplasia, for example, in squamous epithelium of the uterine cervix, glandular epithelium of the stomach, and the liver. So the picture class is a photo of a cervical dysplasia. Nakikita ninyo, from a normal appearance of a cervix into a dysplastic cervical organ. So, cervical dysplasia can lead to cervical cancer. Okay? And then anaplasia. Anaplasia class is defined as a lack of differentiation. Okay, anaplasia is a more advanced stage than dysplasia. It is the hallmark of malignant neoplasms. Kung si dysplasia kanina early form ng cancer or neoplasm, anaplasia class is a more advanced dysplasia. Okay? So detailed explanation of the above underlined terms will be made in the next presentation. Class, we're going to discuss anaplasia when we go to staging and grading of cancers. Okay. Okay, class. So this is after anaplasia. So after that, it will lead to neoplasia. Okay. Neoplasia is defined as abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of the normal tissues and persists in the same excessive manner after a cessation of the stimuli with which evoke the change. Okay, class. Ano yung difference ng neoplasia with other cellular growth patterns? So, neoplasia class occurs without a stimuli. Okay? Yung iba, from hypertrophy to anaplasia, sometimes stops the growth patterns after the stimulus is cut. Okay? Yun yung difference sa neoplasia. Without a stimuli class, the cell regenerates or differentiates. Okay? So neoplasias are classified as benign or malignant. Histology provides a definitive diagnosis and also allows screening and assessment of the spread or staging in cases of malignant tumors. Okay? Histological diagnosis requires biopsy, which may either incisional or excisional. Okay, if you look at the picture class, ito yung normal cells. Ito yung neoplasia or the developing cells ng tumors. Okay, types of incisions. Okay. Incisional biopsy, removal of a small portion of the tumor. This is for the tumors that are thought to be inoperable. Thus, this includes endoscopic biopsy or corneal biopsy, final aspiration biopsy. So, kukuha ka lang ng portion ng tumor and then you will going to test for examination. For excisional biopsy class, this is the most important type of biopsy which allows to assess the extent of the spread. Okay. So kung ang incisional hanggang dito lang, excisional kukunin mo lahat ng tumor. Okay? For grading and staging, so it determines the prognosis and the choice of treatment after malignant tumor is detected. So why is it important to grade and to stage tumors class? Okay? It is important so that we can determine the treatment for that type of tumors. Okay? Staging class is defined as the extent of disease evaluated by the variety of non-invasive and invasive diagnostic test procedures. Okay, we have three clinical examinations, three ways. We have clinical examination, investigations, and pathologic. For clinical staging class uses the different types of tests or imaging procedures to stage this type of tumor. So we have radiograph, isotopic scans, CT scans, or other imaging procedures. While the pathologic staging class involves surgical procedure. So kailangan mo talaga siyang operahan, tingnan yung tumor, the different types of nodes, and then the adjacent tumors if meron. Okay? Wait lang class, ah. Okay? So clinical class, hindi mo kailangan operahan. Okay? So magbe-base ka lang dun sa mga test like their radiograph, x-rays, imaging, CAT scan. Pathology staging, kailangan mo siyang operahan to determine, okay, or to assess the type of tumor. So pathologic staging includes histologic examination, or the tissue removed during surgical procedures. Okay? So, what are the different types of staging? The most common type of staging class is the TNM, alongside with the AJC or the American Joint Committee on Cancer. Okay. Staging. So, the most widely known or the most widely used system of staging is the TNM, okay, the tumor node metastasis system. Originally performed by Pierre Denoix in France in 1940. It's adopted by the International Union Against Cancer and the American Joint Committee on Cancer. If you refer here, class, so TNM, tumor, N for nodes, and M for metastasis. Okay, so T, the tumor, can Yung level niya from TX, no assess, cannot be assessed. T0, evidence of primary. And then TIS, or the carcinoma in situ, meaning yung tumor class is in a cancer form. So it graded, it's a stage from T1 to T4, increasing size or local extent of the primary tumor. For N, the lymph nodes, it can be grade stage from NX, it cannot be assessed, N0, no regional lymph node metastasis, and N1 to N3, or increasing involvement of the regional lymph node metastasis. For M, distant metastasis, dalawa lang, MX and M1. No distant metastasis or distant metastasis. Okay? So alongside with TNM class, ito na siya. Okay. For summary. Alongside with TNM class is the AJC, or the American Joint Committee staging. Divides all cancer from 0 to 4. Okay. So ano yung significance ng staging? Tumor burden increases and curability decreases with the increasing stage. Staging serves to estimate the chance of survival in the individual patient. And it helps to compare the results of the treatment in different institutions. So, yung staging class is universal. So if you focus on the photo class, these are the TNM. Okay? This is the AJC. Okay? So parallel siya in staging the different tumors for cancer. Okay? T1, T1 to T2, TIS is 0. 1 is T1 and T2. Yan. 2A, 2B, 2C for the different classification in comparison to TNM. Okay. Now the grading. So grading is defined as the macroscopic and microscopic degree of differentiation of the tumors. If kanina, staging is both clinical and pathologic, grading naman class is both macroscopic and microscopic. Okay? Cancers can be graded grossly and microscopically. Gross features like exophytic or fungating appearance are indicative of less malignant growth than diffusely infiltrating tumors. Class, this photo is an example of a fungating lesion protruding from a skull. Okay? Based on these features, cancers are categorized from grade 1 as the most differentiated to grade 3 and 4 as the most undifferentiated or anaplastic. Okay? Many systems of grading have been proposed, but the one described by Borders for dividing squamous cell carcinoma into 4 grades depending upon the degree of differentiation is followed for other malignant tumors as well. Okay? So yung approach popularized by Borden and also adopted by von Hansmann. Okay? So they are the leaders in popularizing the grading of tumors. For grade 1 tumor, so well differentiated, closely resemble the normal parent cell. Grade 4, tumors are so anaplastic that even the recognition of their cell of origin becomes difficult. Yan. So hindi mo na alam kung saan siya galing na parent cell, yung grade 4. Okay. So for grade 2 and 3, intermediate between 1 and 4, of course. Instead of using a numerical system, some pathologists prefer to indicate the tumor is well differentiated, moderately, poorly differentiated, or undifferentiated. So this is 1 to 4 respectively. Okay, so how do you grade the tumors class? So here, from grade for GX, G1, 2, 3, and 4. GX class, usually class, merong symptoms, pero you cannot grade the cells, not be assessed. For for G1 differentiated, G2, G3, and 4. For 1, 20 less than 25 anaplastic cell. Okay? For grade 2, 25 to 50% moderately differentiated. For 3, 50 to 75%, and grade 4 class, more than 75% of the cells are differentiated. So yung sinasabi nila, stage 4, grade 4 cancer. Okay? Meaning, the cells are being changed from the normal cell to a differentiated one. Okay? Ito yung mga appearance class. Oh. This is grade 1, grade 2, and the grade 3. Okay, di ba? So if you look closely, you cannot distinguish these cells kung dito ka magsa-start. Okay? So, poorly differentiated ito siya. Okay? So, other grading systems, class, are used also on different types of cancers. So, hindi lahat gumagamit ng borders. Hindi lahat gumagamit ng TNM. So, we have also other grading systems used for other types of cancers. Okay? For breast cancer, breast CA class, we use Scarf, Bloom, Richardson grading system. For papillary intraductal carcinomas of the pancreas, we use the Albores Saavedra grading system. Okay? For correlation for cytologic features, wala pa masyado. For parathyroid carcinoma, walang grading system, wala pang grading system available. And for prostate carcinoma, we have the Gleason's grading system. Okay? And for the kidney tumors, we have Foran nuclear grade. So to give you a glimpse of what is Gleason's grading, ito yan. Gleason's grading system is used for prostate carcinoma. Okay? So nearly normal, some abnormal cells, many abnormal cells, few normal, very few normal, and this is completely abnormal cells for cancer ng prostate. So that is the last slide for neoplasia. Okay. So okay. So far, ano ang mahirap na portion ng discussion? Anyone? You can unmute class if you want to ask something or you want clarifications. The staging and the grading class, you cannot appreciate the staging and grading of tumors class without actual microscopy. Ma-appreciate nyo siya, the grading of tumors, if meron tayong actual slides. The pictures hindi nyo masyadong makikita kasi ito, differentiation. Ito, normal cells. So madali siyang intindihin. But if you're going to view it on a microscope, yung mga cancer cells, mas ma-appreciate nyo ang grading and staging of tumors. Yun lang, mahirap siya. But we will going to follow up on that if the GCQ will be lifted. Okay? So what are your questions? So we have, for week 1, we have 6 PowerPoints all in all. We have 3 assignments and 1 quiz. So saan ba kayo nahirapan doon? Sino ang magsabi?
So far man, sir, wala man, sir.
Madali ba siyang intindihin? Self-explanatory ba lahat? Hala, sorry, itong tatlong last. Sorry.
Hindi masyado, sir. Medyo mahirap intindihin yung sa grading and staging. Good,
Oo,
sir.
sir.
Sorry sa mga late na nag-join. Hindi ko talaga nakita. Sorry. Okay, grading and staging talaga, mahirap siyang intindihin kung PowerPoint lang yung basihan. But if yun nga, sa laboratory, yung mas ma-appreciate niya siya. Okay, for example, I will give you a cancer slide. Okay, grade this tumor. Diba? Mas ma-appreciate niya siya. Kasi you will go focus directly on the different types of cells. Okay, and in connection to signs and symptoms ng patient, for example. Okay? But if you're going to just focus on the slides, medyo mahirap siya. Kasi nga, G1 to G4, ito lang. Walang visual na representation of cells. Okay. So mga nahuli, sorry. Sino yung apat? Okay. So far, I think yung pinakamahirap na portion is the staging and grading. Sige lang, we're going to follow up it on another topic. Meron pa naman tayo discussion on that when it comes to tumors and sa histotechnics. Okay? Much deeper siya. Okay? So, sino pa ang may tanong? Anyone? Sa mga late, doon sa mga hindi nakapasok kanina kasi hindi ko sila na pindot. Meron ba kayong clarification?
Nagawala-wala internet, sir.
Wala, sorry. Ito si Agustin, admit. Ayun pa siya. Di ba nakakatuwa? Di ba? Medyo mahirap talaga. So, wala lang tayong choice, di ba? To adapt on, ito yung tinatawag nilang new normal. Di ba? The new normal for education, perhaps. But, soon, siguro, we will going to go back to our usual platform. But, siguro, we will going to magtiis muna tayo sa ganitong way of learning. Okay? Meron ba kayong iba pang tanong dun sa mga nahuli? Okay? Class, please be reminded na ongoing pa rin ang enrollment dun pa sa hindi naka-enroll, ha? Okay? Habol tayo. Okay? Sino ba ang wala? Ilan ba tayo lahat ngayon? We are 25. Di ba 30 plus tayo? Saan ang iba?
Sir, last na ngayon na day ang
Na-disconnect sila,
enrollment.
sir.
Hindi pa naman. Meron, iba nga sabi namin, kahit maglagay ng deadline, i-accommodate pa rin hanggang kaya. We're going to mag-accommodate pa rin tayo. Kasi nga, di ba, because of this crisis, mag-i-extend talaga hanggang mag-i-extend. Okay. Nahirapan ba kayo sa first week of online learning? Medyo mahirap pa siya. Nangangapa
Yes,
ba?
sir. Nag-a-adjust pa, sir.
Adjusting, sir.
Kuha ko sa inyo, ang ginagawa kasi before namin, yung the best way to para ma-adapt natin siya is to make it a daily routine. Okay, for this time, assignment, ganito, iba naman, merong time for procedures or for different types of topics. Kayo, 3, ang tawag dito, 3 subjects every day, di ba? Okay. So, kailan ba? Monday is another, okay, week 2 na tayo. So, another 6 topics tayo. Kaya? Kayanin.
Yes, sir.
Pero, yung, for those na hindi nakasali, I can send you yung recording nitong ating Zoom conference. Okay. Doon naman sa may mga tanong, you can contact me directly. Yung sa hindi naka-online nakakuha ng mga topics or hindi na pa nakapasa ng mga quiz. You can dalumping sa dulo. Okay. Nagsa-stop ba siya? For example, mahina ang signal, mag-end siya, no? Diretso.
Yes, sir.
Kaya pala.
Yes, sir.
Ganun talaga. Wala tayong magagawa. So, kasi lahat ata tayo ngayon, ito ang platform na ginagamit. Okay? Kahit, I think, elementary and high school class, pagbalik, nila, online learning na rin sila. Di ba imagine? Late na nga tayo kasi college, online learning, sila elementary. Yun lang, walang interaction. Mas maganda pa rin yung may classroom, student-teacher interaction sa classroom, di ba? But soon siguro, we can go back to our normal life. So we pray for that. Okay. Ano pa? Questions regarding sa topics. Okay pa itong topic na parang introduction pa lang tayo eh. So week 2 class, we have different types of cytologies. Techniques. Ano pa ba? Okay. Cytological techniques tayo sa second week. Okay.
Sir,
Wala
yung
bang-
sa
Ha? Assignment.
Sir, yung sa assignment good sa journal,
Yes.
may format kami na sundin or kami na bahala, sir?
Kayo na for that week class, kayo lang muna kasi hindi ako bigay ng rubrics for the journal. Sorry. But you can apply, remember niyo yung rubrics from the journal taking yung sa ating yung sa practice 101. Di ba may journal, may rubrics doon for journal making? You can use that one. Okay. So I will attach, so sa week 2, mag-attach ako ng bagong rubrics for that. Okay. For temporarily, for week 1 na assignment, yun lang muna gamitin natin. Okay. May question ba sa assignment? Malinaw ba ang instructions for assignments?
Yes, sir.
Okay. Sa quiz, may nahirapan ba?
Okay naman siya, sir.
Okay lang siya, di ba? So, yun na yung bagong way of examination natin class. For exam class, I think 50% of the total examination is essay. So, for 80 items, yes. For 80 items exam, 20 multiple choice, 20 true or false, I think, and 40 essay.
Dili na mag-scan transfer.
Oo, di ba? Hindi naman. So, yung
Sir, may time limit ba sa exam?
Yun pa ang pagbibigay pa ako ng kasi consult na yun siya. Magbibigay pa kami ng I think simultaneous lahat ng exams. I don't know Sabay-sabay. Oo. For example, tayo ngayon 8 to 10, 10 to 12, ganyan. Pero i-accommodate pa rin yung yung walang signal, i-accommodate pa rin. So, same platform pa rin for the exam, yung Google form. Yes. True or false, 20, multiple choice 20, 40 for essay. I think may problem ata sa ibang subjects regarding sa quiz. Ano bang nangyari sa quiz ninyo? Sa ibang
Sir,
subject?
gamitin siya, sir.
Ulit-ulit na nagpa-submit, sir ba? Hindi niya sir?
Hindi ma-receive, sir.
Meron din ako nangyari, parang 7 ata yun, na nag-submit, pero pag i-check mo doon sa file, waiting sila. Hindi nakasubmit. Pero parang okay naman ata yun sila. Nakasubmit na lahat.
Yes, sir.
Parang nangyari ata sa ibang subjects classes, na-stream ata sa Google Classroom yung assignment. Ay, yung quiz, sorry. Na-stream siya. Tama ba sa inyo? Ganun ba nangyari? Nag-appear sa stream yung
Yes,
answers
sir.
niyo?
Yes, sir.
Sir. Pero wala siyang name, sir.
Pero walang name.
Walang name. Pero yung
Yes,
answers
puro
nandoon.
essay. Yes, sir.
Makita namin, sir.
Okay. So, nag-stream siya sa platform ng answers lang pero walang pangalan.
Yes, sir.
Wala.
Kasi, sir, meron man kasi, sir, na yung sa baba, good, sir, after mag-answer, meron siyang parang i-send good sa email mo yung mga
Yes.
ina-answer mo.
Ah.
Yung sa iba, sir, wala. Yung sa
Okay.
iba na subject.
So, pag
Kaya
submit,
kung
mag-diretso siya sa email mo.
Oo, kaya hindi kami makasure sir kung nasabit na ba namin or wala pa.
Yun ang problem. Sige lang, pag hindi kayo sure class, directly message yung instructor. Automatic. Okay? Pag hindi ako sure kung submit or hindi, inform the instructor agad-agad. Okay? So I think we should cut our session kasi next subject na kayo, di ba?
Yes, sir.
Okay.
10 pa, sir.
So Miss Ramos, can you lead our closing prayer?
Okay, let us pray. And Father, the Son, the Holy Spirit, Amen. Lord, thank you for this day, O Lord, for the topic today, O Lord. Lord, please protect us and guide us as we go on our day, O Lord. Lord, sorry for all the sins that we have committed, O Lord. This is our prayer. In Jesus' name we pray. Amen.
Amen.
Okay, thank you very much. And again,
Thank you, sir.
on your
Thank you, sir.
households. Walang lalabas. Okay?
Yes,
Thank you,
sir.
everyone.
Bye, sir.
Good day,
Bye.
sir.
Yes, sir. Thank you.
Bye, sir.
Bye.
Bye.